My name is Jenny Van Otterloo. I've been married to my husband for about, will be 4 years this summer. We've lived here in Sanborn, Iowa for the whole 4 years of our marriage. We have 2 kids. We just had one about 2.5 weeks ago. Being in Sanborn, Iowa, there's not a lot of close hospitals. The nearest hospital is in Sheldon, Iowa, which is 10 miles west of us. And they're pretty small. The only pregnancies they take in Sheldon are what's considered a normal pregnancy. Before I got married, I found out I had a pulmonary embolism, blood clots in my lungs that later on were going to play a factor into pregnancies with being on blood thinners and things like that. I've been with McKay now for probably 5-6 years, so she's been aware of my history for a while.
My name is Kimberly McKay. I'm an obstetrician gynecologist in Sioux Falls, South Dakota, and I am the clinical vice president of the OBGYN service line for Avera Health. Avera Health is a health system that covers 72,000 square miles of South Dakota, Minnesota, and Iowa down into Nebraska. And we have about 16 facilities that deliver babies. We deliver 6,000 or so, 6,500 babies a year. So we know a lot about rural. We know a lot about what goes on in rural medicine. 15% of our patients are American Indian. About 10% are other nationalities. Half of our patients are covered by Medicaid either as a primary or secondary insurance. And so, large geography, very diverse patient population. Care planning for rural patients is difficult sometimes. Ideally, they're low risk. They have no medical issues. They are normal weight. They have every resource available to them. But as it turns out, not very many pregnancies in the United States of America are low risk.
So when I looked for different providers near me, both places told me that with a condition like mine, with the blood disorder that I have, they don't have the resources like the blood bank on hand at their hospitals to handle anything that would happen if something were to happen during delivery or during pregnancy. So I was referred to Sioux Falls, therefore back to Dr. McKay in Sioux Falls at Avera.
Prenatal care in general for a low-risk pregnancy is 13 visits, 13 days out of where you take time out of work, 13 days where you need to travel for things like ultrasound and lab work. Add 90 miles, a 90-mile drive to that, and it makes things extremely complicated. Geography doesn't pick and choose the low-risk and the high-risk patients.
The distance is huge. I have to travel an hour and a half to an hour and 40 minutes for every doctor appointment, and that's just one way. So I'm on the road for over 3 hours for a 30-minute appointment every time that I need to go to a doctor's appointment.
We have Avera eCare, which is one of the largest telemedicine networks in the United States. We're looking to add more technology to figure out how to keep patients as close to home as possible until they actually need to come into their maternity center to deliver.
I had really good care. The only thing that Dr. McKay and I talked about, just trying to cut back on some of the distance and the traveling and things like that through video conference calls or whatever, just to do some of those, would be really helpful. I think that would be something that would be great to see happen in the future.
And the other piece is that family practice physicians and nurse practitioners and PAs are an extremely important part about how we provide care. They aren't always as comfortable with obstetrics unless they themselves are personally providing that care in their community. And so much of what we do, in particular through our eCare services, is help them feel comfortable with what they're seeing.
Where's your bus? No, it's not in there? So when I went into labor with my second child, I went to work that morning. I had contractions. They usually tell you to go in when they're 5 to 7 minutes apart. They tell me to come in when they're 10 to 12 minutes apart. So I actually went to work that morning because they weren't that close yet. But by the time I made it to the hospital, I had my daughter within an hour of getting checked into the hospital, so it was cutting it really close. I'm glad we made it and everything worked out okay, but yeah, there's just a lot of extra things that we have to plan with.